considered for people who come just to see what it's about. Then they go out and treat people, and they come back and tell us. Some of them can't believe that they've been able to treat people, but they can't deny it when treatment has occurred. Our statistics show that about 70% of patients are cured, 30% are not.
یه چیزی هم خودمون کمش میکنیم 70% درمان نشون میده 30% درمان نداریم.
How do you explain this 30% failure rate? Some patients don't become observers. By being an observer, we mean that he should remain neutral about what will happen to him.
ولی اونها تجزیه تحلیل علمی میکنن. وقتی تجزیه تحلیل علمی بکنن توی اتصال قرار نمیگیرن، تو حلقه که تعریف طوره قرار نمیگیرن.
We ask them to remain neutral about the procedure, but some of them still want to analyze the process scientifically, and this prevents them from making the connection or entering the ring, and so they can't be treated. According to the law of birth and death, another group generally should not be cured. Nothing has an efficiency of 100%, and everything has a fate. If 100% of our patients were to be cured, death will not take place. But sometimes we can work on these 30% of subjects and help some of them to change their attitude by convincing them that it is not a scientific-based process, and that they should stop analyzing everything. Anyway, a 70% cure rate, and without the use of any form of tools, is a significant figure when compared to modern medicine, and this must be taken into consideration. Can you explain how patients are cured and the process of making connection? The goal is simply to make connection without the use of any tools or techniques. We ask the patient to simply think on the scanning that is being done for him, and he may or may not report the changes that he may feel. The type of disease is also not important. What should the patient do? Nothing at all. He should just remain neutral, simply observe the process. He may or may not keep his eyes open. The scan can detect disease in any part of his body, and it is detected by sensations of pain, throbbing, seizures, coldness, warmth, or visual sensations of colors or light. In this way, disease is detected and the scan will continue to correct any problems in his body. How long does it take to treat patients? It varies from an instant to several sessions, taking 1 or 2 months, but the patient will see the progress after each session. In other words, it's not blind therapy. What does being treated depend on? Depend on the patient's attitude and belief, or on the power of the therapist? According to what I've been saying, it's not the power of the therapist that does the work, but the Lord's wisdom. Also, it does not depend on the patient, provided that he remains neutral during the procedure. There's no specific characteristic that can be said to help improve the process.
خصوصیات فردی، ویژگی‌های فردی چه فرادرمانگر و چه بیمار.
The character of the therapist or the patient also do not have any effect on the procedure, because this process is related to God's mercifulness, which is there for everyone, whether sinful or good.
به هیچ کدوم از اینها ارتباطی نداره و این رحمانیتی است که شامل حال همه است.
Which diseases can be treated? We do not have any exceptions. I can only say that we have experienced on nearly all types of diseases, and we've been able to treat them. Possible to treat him or not. But we have experience with different diseases, including arthritis, which has a mechanical cause. So can you say that the dead end of modern medicine has been opened here? In my opinion, yes, because experience and research has shown that even psychiatric patients whose treatment is very complex and difficult can be treated by this method.
کار خیلی پیچیده‌ای است در اینجا وجود داره و انجام میشه.
What about patients with organ transplants? Theoretically, the donors and recipients' organs or cells have conscious or intelligent phases, which are not the same. The donor cells have one conscious phase, and the recipient cells have another conscious phase. They are not in synergy, and they do not become monophasic. So after some time, the recipients' and donors' conscious phases repel each other, and you see that the organ is rejected in spite of all the best treatments given. Organ rejection may occur after a short time, or it may take longer, like a few months. A part of metatherapy deals with organ transplant patients, and it can make the conscious aspect of the donors and recipients' cells to become monophasic with each other. Organ rejection may even occur in patients who undergo coronary bypass surgery, in which a blood vessel is taken from the patient's leg and placed into his own heart. This is because their cells are not monophasic. We can prevent organ intelligence, and in fact, metatherapy is a game we play with cellular intelligence. You may see the effect in the form of quantitative changes, but intelligence itself is not quantity dependent. IQ is simply something we humans have defined, and no figure can determine the actual intelligence or creative ability of human beings. The intelligence that rules over the universe is more complex and diverse than this.
در واقع صرفاً اونجا با دست بردن تو کیفیت شعوری هر عنصر.
How does the practical part take place? Do your students require your permission to be able to continue your work? Yes, this permission is given through me or our tutors. After a few stages, you can teach method therapy on your own, and you can help others to make the connection. So this course is comprised of a theoretical aspect which explains what God's wisdom and compassion is. After that, you have to make the connection to be able to do something. It doesn't need reading books. This permission is given after signing an oath. The oath is meant to remind the therapist that he should not become proud of himself and that he should not deceive others. This is because naturally after a few experiences he may become proud of himself. It is part of the metatherapist's oath that he must introduce this field correctly to others, which means that they must state that this process is made possible only through God's wisdom, and when this intelligence is involved, the impossible will become possible. People may think that cure occurs through the power of the healer, and they may say that there are a group of people who can cure patients by their powers. This is one of the things that is wanted from these therapists in the oath, and they should clearly state that personal powers are not involved. At present, we are training doctors, psychiatrists, and psychologists, and they are treating their patients by this method. Energy therapy has been used since some time back, and it deals with polarity therapy. This field has been taught in the University of America, and it works on the polarity field of the human body. Polarity therapy has become more popular, and it became an academic field. Polarity therapists are trained through university courses, and this is still so in the world today. However, in Iran there's inadequate knowledge in this field. A small part of metatherapy includes polarity therapy because we see humans as being as diverse as the universe. Human beings are comprised of complex, including bone, muscles and skin, which is only a small part of the human being. In fact, we have cellular intelligence, molecular frequency, and multiple energy channels or chakras, which are studied in acupuncture. Also, we have different bodies, such as the psychological body or the mental body. We have a polarity field and a plasma field, and many other infinite parts. Metatherapy is actually a super holistic look towards humans, and it deals with these various fields and changes our impression about human beings. In metatherapy, this infinite field is assessed, and wherever a defect is found, it is mended. This includes the polarity